And we're in the studio this morning with Dr. Gregory Lynch, vascular and general surgeon, IRMC Physician Group, joining us today as we talk about, well, something that we see and that if you happen to be afflicted by varicose veins or spider veins, you certainly don't want to see as much as you do. Varicose veins, spider veins, they're a fact of life for a lot of people. Our conversation with Dr. Lynch brought to you today by Marcus & Mack, a law firm representing injured people. Good morning.
Good morning.
It's good to have you back with us here today. Varicose veins, spider veins, they are a fact of life. They don't have to be for a lot of people, do they?
Correct. 25 million right now in this country have spider veins, reticular veins, and varicose veins. And they're all part of what we call chronic venous disease. The scenario is you either have the obvious veins that we can see to the naked eye, you have swelling, or you have skin changes, color changes in the skin, which can then go to ulceration. Mm-hmm. So our goal is, if these occur, is to limit the damage that can result in the legs.
Yeah. Okay, so let's talk and frame it this way. Varicose veins, are they dangerous?
In terms, they're veins, okay? And the important thing is to differentiate them from arteries. So arteries supply blood to the legs. The vein delivers the blood back to the heart so it can be pumped throughout the body. So the varicose veins, some studies have said there is an association between varicose veins and blood clots. Mm-hmm. Blood clots can threaten you because they can go up through the venous system to the heart and cause trouble. But again, this is not solid information, more what we call anecdotal. So to frame it properly, you're not in a limb-threatening situation with varicose veins, and most would say you're not in a life-threatening situation.
However, there can be a significant amount of pain associated with them, can there not?
Yes, indeed. And as the engorgement of these veins continues, the legs, again, have the skin changes, which lead to ulceration. The goal is to try and prevent the occurrence of pain. So if you were to have symptoms of swelling, varicose veins, or any color change in the legs at all, you would want to be evaluated.
Yeah, okay. And that is the whole point of something that is coming up Monday, April the 5th. It's a free vein screening. Appointments are available right now. You can make the call. It'll be from 1 until 4:30. Your office?
Correct.
Which is where?
2300 Suite in the hospital medical building.
Okay, very good. And here's the number to call, boys and girls, 888-452-IRMC. That's 888-452-4762. And what did it take? Quarter hour?
15 minutes.
15 minutes?
Mm-hmm.
Okay. So the limited number of appointments available for people to do this.
Correct.
Yeah, so you need to make that call right away, 888-452-4762. That's 888-452-IRMC. Used to be in olden days, they would call it stripping the varicose veins. It's not that anymore, is it?
Correct. No.
Thank goodness.
Yes. Much easier on the patient. We are now seeing an evolution of treatment. Interesting, it dates, all treatment of varicose veins actually dates back to Roman sandals days, where the Roman soldiers would strap their legs because of long marches and being on their feet, because it was well known that varicose veins were not only cosmetically, but were a problem to your actual functioning. So nowadays we do approach it in the same way. Elastic compression is the number one treatment. Going forward, though, we look further or look into why is there a problem with the veins. And that usually means an ultrasound evaluation. Mm-hmm. And again, ultrasound would be recommended if you have swelling, edema, skin changes, or varicose veins. Mm-hmm. And that would give us an idea of what's going on with the veins, specifically the valves in the vein. I like to explain it as the canal boats, and they had the lock system, and the boats would go in, and then the water would rise because the two walls were shut, and then they would open, and you would go out the other end. Mm-hmm. These valves exist in your vein and are directed towards your heart, towards your head. And when you're moving, walking, the blood flows freely towards your heart. When you're sitting or standing, these valves passively close. And what that results in is less engorgement or no engorgement of the veins lower in the leg. Wear and tear, we don't exactly know why these valves break, but they do. And as a result, you have more blood sitting in your lower leg, which results in that engorged feeling, pain, swelling, and sets the whole horse out of the barn problem.
The popular image that we have is that varicose veins affect only women and women who have had children. Not correct?
Not correct. And I would say the severity, the men I treat are generally more thankful. Not that the women aren't thankful, but the men tend to ignore this issue, thinking it's a cosmetic issue, when in reality it's a physiologic problem that can result in great pain. Mm-hmm. And there is such a thing in veins where if you wait too long, you definitely dig yourself a hole. So you want to be ahead of it.
Okay, so let's talk treatment when somebody has varicose veins, and I would guess that the degree of the vein difficulty is going to also dictate the treatment.
Correct. So we look at vein issues in terms of superficial veins, meaning those close to the surface of the skin and those deep in the skin or deep in the trunk of the leg. So it's a double system. Both systems have valves, and both systems can communicate with each other through small perforator veins, which also have valves. Mm-hmm. So when we're looking at the veins, specifically with our ultrasound, we're looking at the valve function. So if the valve function in the superficial vein is inadequate or poor, all the valves are broken down, that would lead us to do what in the old days would have been a vein stripping. Mm-hmm. And we know that's effective at not only removing an unsightly vein, but in decreasing the vein pressure in the lower leg. By eliminating the vein that's bad, you are then pushing the blood into the deep system where the valves are good. Okay, so then you have less pressure in the lower leg. So we try not to do the valve stripping anymore because we have better methods. Yeah. And the one that I find most helpful for my patients is a Claire vein instrument, mm-hmm. which is introduced through a vein around the knee area, just a little local anesthesia, and it is a wire similar to the wires we used in cardiac catheterizations to enter fine, small blood vessels, but it's angled on its tip, and it revolves 3,500 revolutions per minute inside your vein. Mm-hmm. Now, that sounds like that's high energy, but actually the wire is so fine that most people don't feel it at all.
Oh, yeah.
And then, so that kind of, it does scrape the inside of the vein, and then we gently pull back as we examine. Again, we're doing this under ultrasound, and inject what we call a sclerosant agent, and you can think of that as a salt, heavy salt. So the combination of scraping the vein and putting a little salt on there actually closes off the vein and accomplishes what we used to do in a relatively brutal fashion in the past. And so the patients can expect to have this procedure done in office, and go back to work shortly thereafter.
That's the thing that I wanted to be sure that we pointed out was I remember family members who had the vein stripping, and it was actually involved hospital admission for a couple of days, 2-3 days.
Yes, and out of work time.
Yeah, and that's no longer the case.
No.
Now, you're going home same day.
You're going.
It's an office visit,
and it's not unreasonable to go right back to work. Now, again, there are people that are sitting all the time or standing all the time. I would not recommend they go back to work the same day. But a mailman or someone that is moving.
So the event that is going to be coming up on Monday, April 5th, at your office again, which is at 841 Hospital Road. That's a hospital suite 2300. You're going to take up 15 minutes of time. What's going to happen during that event? What are you going to do?
Well, we'll have a questionnaire, a history of sorts, what's going on with your legs, and then a quick examination looking for swelling, color changes, varicose veins, spider veins, and then we'll make recommendations. And the prime recommendation would be ultrasound evaluation to determine what's next.
We've been talking primarily about varicose veins, and quickly, spider veins. Give me a nutshell on them.
So the spider veins are finer. You're talking 3 millimeters, and they're these blue patches that you see. So while they are a vein issue, it's very difficult to identify an exact physiology, in other words, why they occur. But we do know they can be readily taken care of with injection therapy, that would.
So whether it's spider vein or varicose vein, it's a really good idea to make this appointment. And again, the number is 888-452-4762. That's 888-452-IRMC. This is a free consultation.
Yes.
It'll take 15 minutes. It's going to be on Monday, April the 5th, a limited number of availabilities. So there you go. If you've been hesitant to wear shorts in the summertime, we're thinking about it right now, aren't we? About wearing our shorts and getting out there. This is something that you might want to consider. So summer's coming, and certainly we want you to feel and look your best, and Dr. Gregory Lynch is going to help you do that. Thanks so much for coming in to visit with us today. Appreciate it.
Thanks. Appreciate it.
It is the voice of Indiana County, WCCS 101.1 FM and AM 11 FM and AM 11